Hi guys, hello. Hypoglycemia is what we're going to be talking about today. So don't scroll past this post because it's going to really help you. Now, what is hypoglycemia? Hypoglycemia simply means abnormally low blood sugar level, glucose level in the body. So now we are talking about the range here. Anything below 3.9 and below is what we call hypoglycemia. That's low sugar level in the body. So glucose is in your body. That's the main fuel. Glucose is your body's main fuel. That's one thing you need to understand, especially for the brain. So when it drops too low, symptoms can come. And when I talk about symptoms, the symptoms that can come can actually cause can be life-threatening. So now, what are the causes of hypoglycemia? The causes of low glucose level, low sugar level in the body simply means one of the causes could be diabetes. The person could be diabetic, or the person is not sure, and then too much of insulin or diabetic medication can also cause hypoglycemia. Also, when you skip meals or you delay your meals, that can as well cause that as well. Then also we have also exercise more than usual without extra food. That can cause hypoglycemia as well. Or you drink alcohol, especially in an empty stomach. So these are the things that can actually cause hypoglycemia. So now, what are the symptoms of hypoglycemia? They can range from mild to severe. So I'll start with the mild. Mild simply means the early stage. Shakiness, you're shaky, you're sweaty, your hunger, dizziness, palpitation, and anxiety or irritability. Then we also have what we call the moderate bit, the moderate to severe. That could come in form of confusion or trouble concentrating, blurred vision, slow speech, seizure, loss of consciousness. And the loss of consciousness could be medical emergency. So we class the moderate to severe as medical emergencies. Say, for example, you go and see your patient and your patient is having 1.1 or 1.0. That is really, really life-threatening. So you need to immediately escalate care to the appropriate team. So you have the medical emergency team to call. You know the next line of support to call. You have all the numbers available. So that's why you need to be sure. You need to have all these numbers available to call for a medical emergency, for immediate help. And also, if you go and see a patient that's having hypoglycemia, what do you do? Rather than panicking, you're making the phone call. You put the phone on speaker. So basically, what you need to do, I have here what I call the glucose juice here. So it's the glucose juice. So this is a glucose juice here. So everybody needs to have this in your bag. You need this in your bag. The reason why you need this, you can save a soul out there. So like for me, I've just done how to check my sugar level. So you can have that kit as well in your bag at every point in time. So if you're feeling unsure, like losing concentration, you are feeling dizzy, you check your sugar level. Having checked your sugar level, if you notice that you are suffering from hypoglycemia, then you can quickly take one of these. So this is called, if you look at the glucose gel, it's called fast acting. So this can bring back your sugar level up quickly while you're waiting for help to arrive. And also, if you've got access to like digestive biscuits or apple juice, you can take that as well if you are okay taking it. So if you are allergic to those if you have food allergies to biscuits, digestive biscuits, you don't have to. But then if you're not, you can actually take that as well. That will really help you to bring back your sugar level. So if the person is awake and able to swallow, so don't forget, when you're treating hypo, the person should be able to swallow. So you're not going to choke somebody that is not able to swallow. So, and having said that, when the person has recovered, so if you are going to administer your insulin, you have to put it on hold in that first instance. If it's a patient you are going to see, you have to put it on hold. You treat the hypo first, then you seek help from the relevant your line managers and the people, the specialists involved in the team. So you seek advice from them before you get this done. So why am I doing this? I am bringing up all these things because as a point of reflection and to educate other people out there as well. So if you're out there, you don't know where your sugar level is, you really need to know where your sugar level is. So please give 15 grams of fast acting sugar, just as you can give this as well. So now, what to do in that kind of situation? You've had this and it's not coming up. You give yourself 10-15 minutes, it's not coming up, it's still very low. You can actually take 3 to 4 tablets of glucose tablets. So this is what I call the glucose tablet. Remember, I've showed you the juice here. You've had this juice for 10-15 minutes, you've checked your sugar level again, it's still very low. Then you are taking this one, at least 3. So if you are taking this one, a few of these glucose tablets, so these things I've just showed you, you need to have them in your home. It's really, really good. That will be your first aid. That's your first point when you want to treat anything that has to do with hypo. Very, very important. Then you can take 1 tablespoon of honey. Please, after you've done that, wait for 15 minutes, then recheck your symptoms or your sugar level to see how that is. If it's come back up, if it's still low, then you have to repeat the process all over again. I've also got one here, what I call the glucose boost. So the glucose boost here, it's very, very good as well. So if you've tried these two, I've just told you, if you've tried this one, it's still low, you've tried this one, after 15 minutes you've come back to check, it's still low, then you can repeat the process again. So sometimes I just do variety. I can take this one of these one, and then apple juice, and then let me digest this, or just apple juice and this, if the person is able to swallow. Okay, so you repeat the process again. Once better, eat a small meal or snacks with carb or protein to prevent another drop. So that is why when somebody is recovered from hypo, we encourage them to please eat carb and protein meal to prevent further drop in the sugar level. So if the person is conscious, or if the person is confused or unconscious or having a seizure, do not give food and drink. Listen very carefully. If the person is confused, unconscious, and having a seizure following the drop in sugar level, please do not give food and drink, because obviously that person is going to choke. Give glucagon injection. It's an injection that that can be given by trained personnel. Okay, so that is why when you notice all these symptoms, you call for medical emergencies. And normally when they are coming, when you tell the symptoms, when they are coming, they have all these things in their kits. So they'll make sure they give that, get that administered. Call emergency services immediately if you're unsure what you're doing. Now, how to prevent hypoglycemia? Please, number 1, eat regular meals and snacks at the right time. Some people's meal can be variable, but then please, your meal shouldn't be variable. And also, I have what I call match insulin and meds to food and activity. It's better that way rather than having not eating. You're having your insulin, but you're not eating for the rest of the day. Some people can just be like that. You give them their meals, they will never eat when they've had their insulin. So that is why you need to check all those things. Carry out quick sugar source at all times and monitor sugar level. So that is why before you give insulin, it is good practice to check their sugar level, to know their baseline, to know their target level, and before you administer. And if you got any problem, if you're unsure, if you think there's something you're unsure about, speak to the specialist and they'll be more than happy to guide you. So I've been in that situation as well, where I literally did not know nothing to do, but then with the help of my team, and then with the help of specialists around, people are always there to teach you. All you need to do, if you don't know, hands off, people will help you, and then you get there. So checking your sugar level is very, very important. I hope now you know what hypoglycemia means. Hypoglycemia, like I said, simply means low sugar level in the body. And why does that happen? I have told you. And how to prevent it, I have told you. What do you do when you have hypoglycemia? You take one of these, check for 15 minutes. If it doesn't work, you can take 2 to 3 tablets of this. If it doesn't work after 15 minutes, you repeat the process again. You can take this one. And if you feel the person is unconscious and not eating, please stop. While you're doing all this, you're calling medical emergencies. And when they're coming, they'll come with a glucagon injection and other things to revive the person. Sometimes they do IV therapy as well to bring the person's sugar level back home. If the person meets the criteria to be taken to hospital, they'll take the person to hospital as well. But what you need to do to have the basic understanding of what hypoglycemia is and how to treat hypo in the first instance before emergency help arrive. Thank you for watching. I hope this video makes sense. See you in my next video. Bye.